Thank you for joining us. I'm Dr. Anastasia Stocker, and I'm here with the great Dr. Mary Schroeder, doing another doc talk and talking about something that we see a lot clinically and we talk about with a lot of women, and that's menopause. So we're just going to go ahead and jump in and get started. Please feel free at any time to unmute, ask a question, put it in the chat, email us afterwards, and we'll put up our email if you have any questions or clarifying questions about anything, or just following up with if you see any of the providers in ARIA, they can answer all the same questions. Just let us know if you have any questions. Okay. Oh, let's see if I can. Okay, so like I said, I'm Dr. Anastasia Stocker, and this is Dr. Mary. We're both naturopathic doctors and acupuncturists. So as we go through this talk, we're going to kind of be going through both the Western medicine and naturopathic side of things, as well as highlighting some things in Chinese medicine. And I'll get into it a little bit later, but it's definitely interesting how there's a big overlap between the two practices of medicine and how they can both help with menopause and making that transition a little bit easier. All right, so first we're just going to start with some basic definitions of what menopause is. Menopause, the average age of onset is about 51 years old, but that is very variable from woman to woman. A good idea is to kind of look at your family tree and see when your mother, your grandmother went through menopause to see about the time that you are more likely to go through menopause. We'll just lightly talk about perimenopause, and that's that time before you are in menopause officially, which is by definition no menstrual cycle for greater than 12 months. During menopause, your cycles become irregular. They can be really short, they can be really long. There's changes to bleeding. Sometimes we see really light bleeding, other times it's heavy bleeding. The length of bleeding can change. So if you used to bleed for 3 to 5 days, you could be bleeding for a lot longer or a lot shorter. And this pattern from person to person can kind of change as you progress through perimenopause. Premature, so what we're not going to talk a lot about is premature menopause, and that is menopause occurring before the age of 40. This is if you are noticing you're not having a menstrual cycle for lengths of time before 40, that is something you want to go and see a doctor and talk about, because we really need to protect your cardiovascular and your bone health. And so talking to your doctor about early menopause is important. And then there's surgical menopause for when you need to have your ovaries and uterus removed for a particular reason, and that can kind of happen at any stage of life. And that again will come with some different outcomes for each individual and how we need to treat you as a whole if you do have different organs removed. Okay.
Okay, so next we're going to get into a discussion of what is happening on a physiological level during menopause and perimenopause. So as you can see here, during the fertility years, we have our hormone cycling, and it's funny that it's not an incredibly accurate graph on the left-hand side, but if you're looking at the average estrogen and progesterone, we have a relatively level amount during our fertility years. Although really the reality is our hormones are cycling during this time. So we're having this kind of more regular ebb and flow of estrogen and progesterone on a monthly basis. Now, when we get into the perimenopause years, progesterone starts declining, and so does estrogen to a lesser degree. That's when you can notice that you're going to have heavier periods and more irregular periods, and a lot of emotional changes. With that declining progesterone, we'll often see a lot of insomnia and anxiety occur, in addition to the 10 days of bleeding, bleeding much heavier than you used to, and then spotting in between cycles. So that's normal during around the ages of somewhere in the 40s. It'll vary with each person. Now, when we get to menopause, we'll have declining estrogen, but that's, we think of during menopause, the declining estrogen being the full story, but it's actually much more complicated than that. What we'll see is these drastic fluctuations in estrogen. And that happens because, so first of all, our estrogen starts declining after we stop ovulating. So we have a set number of follicles in our ovaries, and as they age, we'll start to stop releasing them on a monthly basis. And it's those follicles that are first secreting estrogen in the first half of our cycle, and then secreting progesterone in the second half. It's the kind of scar tissue that's left over from the ovarian follicle that secretes progesterone on a monthly basis. So as we stop releasing those follicles and those eggs each month, we're going to stop having our estrogen and progesterone being produced from our ovaries. And this will cause a feedback loop signal to the brain. So there are these precursor hormones coming from our brain that tells our ovaries to secrete estrogen. And when estrogen starts to decline, we have that feedback towards our brain, and then the precursor hormones are saying, hey, we need more estrogen, secrete estrogen. And so you have this spike in estrogen levels. And then after that spike in estrogen levels, it'll feed back and say, oh, right, we're good. We don't need any more estrogen for now. And then you'll have a drastic decline. So this is when we really start to notice a lot of more intense emotional changes, more intense hot flashes, and just this kind of fluctuation. It's kind of like you're having PMS, but much more frequently and much more erratically. And then postmenopausally, we'll see that we still have estrogen being produced, and I'll talk about that in the next slide, but it's at a much lower level. And that's when we start to notice things like signs of more significant estrogen deficiency. So things like vaginal changes, cardiovascular changes, changes to our bones. So those are kind of the more long-term effects of our having a lower baseline estrogen. And we'll get into that a bit more in the next few slides. So here, I'm just going to go into the multiple hormones that are involved in the menopause process and how they're affecting us physiologically. So estrogen, we use the term estrogen to describe one of our primary female hormones. And in reality, there's 3 different molecules that we're talking about when we're talking about estrogen. So we have estradiol, we've got estriol, and we've got estrone. Estradiol is the main hormone that's produced during our fertile years. And it's produced from the ovaries, and that is the main one that declines after menopause. This is the one that has the most influence over our estrogen receptors throughout our lifespan. And we also have an estrogen that is produced mainly during pregnancy from the placenta, and that is called estriol. Estriol is known to be protective to breast tissue. So it's a form of estrogen that's often used in menopausal hormone therapies. And then we have estrone, which is produced in fat cells. And this is the main estrogen that's present after menopause. And this is associated with some of the more harmful effects of estrogen. So we want to be thinking about all of these forms of estrogen and how they're playing out in our body when we talk about menopause. So we also have some other major players on the hormone stage, and that includes progesterone. So that's one of our other major sex steroids that's present during our premenopausal years. And progesterone is going to also start declining during menopause, as I was discussing before with that graph. It really starts declining more drastically during perimenopause and then continues during menopause. Progesterone is the hormone that keeps our uterine lining in place and prevents bleeding. So as that progesterone declines, we're going to have more intense bleeding during menses. And it also can have significant impacts on our mood. So often when progesterone is higher, that can help with anxiety and insomnia. When it's too high, it can cause weepiness and bloating and things of that nature. So when we have these declines in estrogen and then these spikes in estrogen, we're going to see a lot of mood changes during that time. And then next we have testosterone. That is also produced in the ovaries, surprisingly enough. And that testosterone can play a major role in our metabolism, in our energy level, and in libido. And we do see a decline with testosterone as we stop releasing eggs on a monthly basis as well. Lastly, we have DHEA. This is a hormone that's produced in the adrenal glands, and it can be used to form all of these other kinds of hormones. So it's a precursor hormone, and it can contribute to estrogen and testosterone levels to some degree. And so we also want to look at that as we're considering the hormone changes during menopause. And there are some options for supplementing with DHEA that can help during the menopause transition as well. Okay, so estrogen can have major impacts on our body in ways that we might not think about being connected to our sex steroid hormones. So it's really more of a global hormone than just a sex steroid hormone. So it helps regulate our skeletal homeostasis in both men and women. It stimulates the growth of breast and uterine tissue. It can be protective against neurodegenerative disease, so it has some impact on circulation to the brain and the health of our blood vessels in the brain. It also can play a major role in cholesterol regulation, so we'll often see lipid dysregulation after menopause. And it contributes to our skin and vaginal tissues. So we can notice some change in the kind of thickness and lusciousness of those tissues pre and post menopause. And then lastly, it can have some significant cognitive effects. So I heard a long time ago that a specialist in women's health often planned any lecture she was having around the time in the first half of her menstrual cycle, because that's when estrogen was higher, which I found really interesting. And we do see that play out clinically, where there's just a slight more sharpness to mental function when estrogen is higher. Okay, so coming into the menopause transition, we're going to notice many different symptoms that occur at different times during the transition to perimenopause and then menopause. So during perimenopause, again, we're going to have that declining progesterone, and we're going to start to see that fluctuation in our estrogen levels. And so a lot of the symptoms around that time are similar to PMS. So they're just coming on more strong, more frequently, and more erratically. So we'll often see things like low energy, low libido, mood swings, acne, headaches, and things of that nature that you may be familiar with PMS. And then we'll also, as we move further into menopause and our estrogen levels decline further, we'll see things like hot flashes, eventually vaginal irritation and dryness. And we will get more into that later on. But as I was mentioning, estrogen can play a big role in maintaining the skin of everywhere in our bodies, including our vagina, and also maintaining the mucus production in the vagina. So often as we get further along in menopause, we'll notice irritation and dryness in that area. Let's see. Also moving further along in menopause, we'll have symptoms of decreased bone loss potentially. So, building bone is something we do throughout our lifespan. And when often in more petite individuals, maybe who have had exposure to corticosteroids or not enough calcium throughout their lifespan or not enough exercise, we'll see bone mass be decreased. And as estrogen is responsible for helping build bone. And as that declines, we can see a decline in the bone density. And this is often a silent condition. So it's one of the reasons why we really are making sure our patients are getting DEXA screenings at the appropriate time. That's a bone density scan that will look at the health of your bones. And if it goes unacknowledged for many years, you can eventually have bone fractures. So that is related to lower estrogen later on in life. All right. So today in our talk, we're going to really focus on hot flashes and vaginal irritation and dryness, because those are two symptoms that will really impact people's quality of life significantly, and something we see often in practice. And as we discuss these, we're going to discuss a lot of therapies that are appropriate for general hormone support during the perimenopause and menopause phase as well. So what causes hot flashes? Sadly, we know very little about what causes hot flashes. You would think that given that half of the population experiences this at some point in their life, we would know more, but we don't. So we know that it's related to declining estrogen, and we also know that it likely involves the centers of the brain that control temperature. We know that it is that estrogen impacts our vasomotor response, and that's a fancy term for our blood vessels dilating and contracting. And there's some mechanism that's not well understood whereby declining estrogen will make it harder for us to regulate that vasodilation and contraction. There's also likely involvement of serotonin and stress hormones like epinephrine. And so we are often paying attention to those nervous system pieces, to stress and anxiety and cortisol, as we're addressing menopausal hot flashes.
Okay, so I'm going to do my best to kind of introduce the Chinese medicine perspective. It can be kind of confusing. If there's any questions, please let me know. So when we think of Chinese medicine sees the person as a whole being. In Chinese medicine, we have these natural cycles. In women, it's 7-year cycles, and men, it's 8-year cycles. And this is just talking about like growth and development. And when we think about this, we're talking about what we call the kidney jing, which is your essence, your life, your vital force. And it is really responsible, like I said, for that growth, maturation, and transition in aging. What's really cool about this, it's kind of, they're talking about estrogen when we talk about these 7-year cycles. So we can see the ages correlate to normal development in young girls, and then as we go into perimenopause and menopause. And so it's responsible, it's normal as you age that your kidney jing to normally have a decrease. And we see this as a physiological decrease in what we call the tian gui, which translates to your estrogen production, which I find really interesting. When we talk about Chinese medicine, a lot of times things don't fully translate, and we have to kind of make assumptions about what Chinese medicine practitioners were in Western medicine and Western physiology. But this kind of like directly translate, which I think is super interesting. So when your kidney jing is plentiful, the menopause transition is very smooth. You don't have a lot of symptoms. You don't have a lot of those hot flashes, night sweats, mood changes. But if you have any sort of pre-existing kidney, what we call deficiency, or other patterns that your like acupuncturist would talk to you about, so things like spleen deficiency, which is your digestion, or liver qi stagnation, which regulates your emotions. These things can cause your kidney to become what we call deficient. In Chinese medicine, we kind of think of the kidney as a bank. You can never have too much in your bank, so you can only ever have a deficiency. You're only making too many withdrawals from the bank, and that can lead to symptomology when you're making your transition into menopause. So some common patterns that we see in menopause. It's normal for your kidney jing to decrease. The kidney jing kind of gets divided into kidney yang, which is this hot, fiery energy, and kidney yin, which is cooling and a moistening energy. And so when you have deficiency of either one, you can kind of see some overlap in symptoms. We see hot flashes with both of them. With kidney yang, since it's a hot energy, we see cold symptoms when it's deficient. So feeling cold all over, having a cold low back or your hands and feet feeling cold. If there's cold in your digestive system, you don't have enough energy to digest food, so you can see undigested food in your stool. You can have low mood, so depression. We see low libido, swelling. And then if you've ever seen an acupuncturist, you know we're going to be looking at your tongue. We're going to be taking your pulse. We'll see a pale, flabby tongue. Taking your pulse, it feels deeper, it feels slower. Versus a kidney yin, on the other hand, is a deficiency in that cold, moistening energy. So we see more heat symptoms. We have more hot flashes. You feel hot, mainly hot in your chest, your hands and your feet. You have more night sweats. And this is because at night is what we call a yin time. So you're sleeping, you should be restoring. But if you have not enough yin in the yin time, you wake up, you're sweating, you have more of that yang energy. You can get dizziness because we don't have the root to hold the energy from going upwards. And the same thing with the ringing in the ears. You have more constipation, dryness. You just don't have that moistening effect of the yin fluids. And then with both of them, we always have a saying when we think about kidneys, and it's low back pain and weakness of the knees. So anytime we see those symptoms, we know there is something going on with the kidneys that could use some support. And then when we think about menopause, we often see an overlap between the kidney yin and yang. They're not rooting each other, so you can see these symptoms, and we see one or the other predominate. But as you either get older and you don't address these symptoms, you can kind of have a mixed symptomology and see both a yin and yang deficiency. Okay, so when our overall goals with patients during the menopausal transition is first to get an understanding that this is a natural event. It's not a menopause is not a pathology, and I think that's just really important to remember. It's what we were born to physiologically do, is to have these transitions, and it's about finding that balance and balancing in the hormones and how we see and treat our bodies, right? So we want to support estrogen so we can have those protective effects of cardiovascular and brain health, bone health, in your immune system. And of course, it's about managing symptoms so you can have a good quality of life. So you're not experiencing hot flashes that are waking you up. So you are able to sleep through the night, do the things you want to do, because ultimately our goals with patients is to help you create the life that you want, that you're not being burdened with symptoms.
Okay, so next we're going to get into some treatments for and how we approach the treatment holistically for hot flashes. So we're going to discuss a number of strategies, including nutrients and dietary strategies, exercise and lifestyle approaches, and also what we can do with botanical medicine and hormone therapy to help lessen the symptoms of hot flashes. Okay, so when it comes to hot flashes, there's a number of things that have been shown in the literature to be supportive. And it's going to be, it's kind of an all on board approach. So often, hot flashes can be really difficult to address. And it's often not realistic to completely get rid of them. And so I want you to keep that in mind as we go through this, that we're really kind of building a lifestyle whereby you're kind of integrating each of these pieces, and each piece might kind of help a small percentage. And as a whole, over a period of 3 or 4, 5, 6 months, we'll often see a decrease in symptoms, improved sleep, and all of that. So when it comes to the diet, it's been shown that increased omega-3 fatty acids and healthy fats is helpful, and avoiding red meat and animal products like cheese and butter can be overall supportive of decreasing symptoms. And I'll get into the specifics of the healthy fats in a couple of slides. We really want to pay attention to eating a low glycemic diet. So that's going to be a diet that's not spiking our blood sugar. So that's going to mean pairing any carbs with a protein or a fat, and aiming to eat high fiber, aiming to avoid any refined sugar and refined carbohydrates, and really just making sure we have that balance of the proteins and fats in our food, so that we're slowing the release of blood sugar into our system as it's kind of absorbed from our digestive tract. We also want to pay attention to eating low salt. So typically that means not loading each meal with extra salt, and also really avoiding processed foods. So in most diets, it's the processed foods that have the hidden amounts of salt. So things like potato chips, even like nutritional bars, and often really avoiding things like French fries and those kind of heavy hitters when it comes to salt intake. Next, we want to avoid spicy foods. So particularly if you're having severe hot flashes. Spicy foods can often dilate our blood vessels and worsen hot flashes. So generally, for general health, I don't avoid spicy foods unless you're kind of dealing with that kind of heated condition like a hot flash. And in that case, really kind of focusing on cooling foods, which Dr. Stocker will discuss in a few slides, is really important. So lastly, we want to minimize caffeine. So, caffeine from coffee and tea. We have seen that excess amounts of caffeine, like upwards of 2 or 3 cups of coffee a day, will worsen hot flashes. So the next dietary intervention I'm going to talk about is including phytoestrogens. So phytoestrogens are constituents that are estrogen mimicking that are found in certain plants. And we can find that in food and herbs, and we're going to talk about both forms of phytoestrogens in this lecture. But there's a number of different types of phytoestrogens, and that includes isoflavones, phytosterols such as coumestans, and lignans. And these are all found in different vegetable and legume foods. So in order to get phytoestrogens in your diet, you really want to increase your intake of soy. So you can find that in things like tofu, tempeh, soybeans, soy milk, and miso. You want to include things like alfalfa, lentils, chickpeas, pinto beans, lima beans. There's lots of different options for that. And then next, we want to think about bringing in things that contain phytosterols. So that'll include sunflower seeds and bean sprouts. And then lastly, we've got lignans. So, and that's found in things like flax seeds and certain fruits and vegetables and whole grains. Interestingly, the lignans are converted by our intestinal flora. So the presence of certain types of beneficial microbes in our intestines will determine how effective the lignans will be for us. So that's a very individualized thing. And those estrogenic compounds are then absorbed in the body and will go on to bind to our estrogen receptors. So the phytoestrogens act on the estrogen receptors kind of like a lock or a key to a lock on a door. And while the estrogen that we produce in our body, the estradiol, will bind to that receptor and stimulate it fully, or it's kind of like a key that really fully opens the door. The phytoestrogens will open the door, but halfway. So they'll exert an estrogenic-like effect, but it won't be as strong. So this can actually be helpful throughout our lifespan in lessening our estrogen effect when estrogen is really high, and in providing more of an estrogen effect when estrogen is low. So it can be protective for bone health over our lifespan, and can help do things that it can modulate certain physiological processes that involve estrogen. So it can help with hot flashes and slow osteoporosis. And in certain studies, it was in rat studies, it was shown to increase the maturation of vaginal cells. So that's another estrogen mediated process. So that's the dietary component of the phytoestrogens, and we'll discuss the botanical medicine options for getting phytoestrogens in later on in the PowerPoint. Okay, so here's just some specifics on how to choose the fats that are going to be supportive during the menopause transition and specifically with hot flashes. So we really want to increase omega-3 fatty acids, and that's going to include the omega-3 fatty acids are found in things like fish oil and marine lipids, unrefined flax oil, salmon, and that's often, you really want to focus on wild caught versus factory farm salmon. We'll find it in things like chia seeds and flax seeds. So a really simple way of getting some more omega-3 fatty acids and fiber in your diet is to include 2 tablespoons of flaxseed per day. And you can grind that into smoothies or oats, and you can even make flaxseed muffins. That's been shown to help with hot flashes. So here you really just want to make sure that the flax seeds are ground, because in whole form, they just move through our system and we are not able to use the lignans in them. So other things you want to consider including is extra virgin olive oil and things like raw nuts and seeds and avocado oil. And again, really keeping to a minimum things like red meat and butter and cheese, but increasing things like fatty fish and chicken and lean meats. So here's a great recipe just for your reference for chia seed pudding. I like to really make these interventions accessible and kind of decadent and enjoyable. And so you can refer to this for making some chia seed overnight pudding and increasing omega-3s in your diet that way.
Okay, so I'm going to talk about Chinese medicine whole foods. I will just make a note that I love making those chia seed puddings. And if you don't like the texture of the little chia seed balls and the little pearl, you can blend them up and you're going to still get the effects of the omega-3s and not have the beads of chia in there if that's something that you're not into. Okay, so Chinese medicine, one of the big tenets is working on the diet and working with whole foods. So like Dr. Schroeder was already talking about, decreasing processed foods. So that's eating whole, fresh foods as much as you possibly can, avoiding those overly processed foods, just really increasing that variety of fresh vegetables and fruits. You know, eating the rainbow is kind of our go-to, filling your plate with half vegetables if you can, trying to eat local, fresh, and in season. And this in season piece can be really big when it comes to Chinese medicine, because how we tonify both those yin and yang energies is based on the season. And generally we can look to nature and it will tell us what to do, right? So the fruits and vegetables that grow in our area in the season are going to be more tonifying than other foods. And then just one of the main tenet in Chinese medicine is cooking your food. Eating cold, raw foods will really cause that yang deficiency to worsen. Just applying cold to heat is, in your digestion needs a lot of heat to break things down, to process them, for you to assimilate everything. So just doing your body a favor and just helping with it, and just cooking it a little bit to help you start that process just helps your yang energy. Oh, it's got a little weird. I don't know what happened here. Sorry about that. But so some yin nourishing foods. So when we're seeing those symptoms of kidney yin deficiency, and that's really the hot flashes, what we call that 5-center heat. So on your chest and your hands, the night sweats, you're going to want to help build and nourish your yin material. So this is eating protein-rich diet, rich in all the things that Dr. Schroeder already talked about. Soy, dairy. They do lean on a little bit more animal meats, but less so the red meats, because those can be red meats in Chinese medicine are really hot, right? So it has more of that yang energy, which can further deplete yin. So we're looking for flavors that are sweet, slightly sour. So when you're looking at fruits and vegetables, these are like apples, bananas, pears, the whole list I have listed here. Vegetables that are going to be more moist and juicy, that can help provide that yin moisture. I'm not going to repeat everything that Dr. Schroeder did, but it's very interesting that in Chinese medicine, they've been doing this for thousands of years, and we're just now learning the like physiological reason behind it. So some extra things that animal products are eggs, duck, rabbit, specific black bone chickens, and those deep water, which are deep water seafood, right? Deep water fish that have more of those omega-3s at higher concentrations. And then honey and oil and nuts that can tonify your yin. A great little recipe is congee, and this is generally just rice that is cooked with a lot of water. So generally a rule of thumb is 1 cup of rice, rinsed, and then you use either between 6 to 10 cups of water to cook that rice, and then adding in these different vegetables, so like lily bulb, in any of the vegetables that you kind of like, to help nourish your digestive, which is your spleen qi, which is going to ultimately feed into our kidney and our kidney yin and yang. And then, like Dr. Schroeder was already mentioning, one of the big things when we're thinking about nourishing our yin in Chinese medicine is avoiding these heat-producing foods, which we call fa wu foods. And this is large amounts of alcohol, which will disrupt your intestinal barrier and be hot. Spicy foods, deep fried foods, barbecue foods, foods that like if you just think about how food is prepared, adding lots and lots of heat, so deep frying things, putting on the barbecue for a long time, eating the spicy foods, that's just the energetics of the food is going to be hotter. So we're trying to avoid those things as we try to nourish our yin and try to increase that cooling and moisturizing effect of the kidney yin. On the opposite hand, if we have more of a yang deficiency and we do want to increase that that more hot energy, we kind of do a little bit opposite. So we want things that are sweet, pungent, more warming. And so this is just adding a lot more spices to your food. So warming spices like ginger, where dry ginger is going to be a lot hotter energy than fresh ginger, basil, anise, all these warming spices. Like right now, we're definitely in pumpkin pie spice season. So like all those things, right? Cloves, cinnamon, nutmegs, all those things are going to help nourish your yang. And that's really important as we go into the winter season, because the yang energy is going down. So we have to add those things to our food. And we just kind of do that culturally to add these warming spices in to balance the yin energy of winter with foods that are going to help support our yang through the season. Different nuts like chestnuts and walnuts and pistachios, and then those animal meats that are definitely hotter in energy. So things like lamb, deer, some of those more gamey things that are more hot energetically. And then things like lobster, which you would think it comes from the sea, it'd be cooler, but lobster is actually hot. And so I think I already mentioned this before, to protect your yang, especially coming into this winter season, avoid drinking cold drinks. So sometimes this balance between yin and yang, it's really important. So like if you have a presentation of being more yin deficient, that doesn't mean they're interrelated, yin and yang, right? We think of that, the yin and yang symbol. If one is becoming depleted, the other one eventually will become depleted. So even though you feel hot with like maybe some yin deficiency, we do want to still avoid drinking really cold things, because that eventually is going to deplete your yang energy. So especially coming into the winter, room temperature water, we want to just kind of protect our yang.
Okay, so next we're going to get into some lifestyle pieces, and just other things to think about when it comes to managing hot flashes. So Stress management is huge. As I was mentioning before, there's a lot of neurotransmitter involvement in the production of hot flashes, namely adrenaline and serotonin, and kind of keeping our brain chemistry happy and managing stress is really important. So that is, going to be a really individualized approach for each person, but thinking about what works for you, whether that's going for long walks outside, spending more time with your kids, having dinners with friends, meditating, dancing. There's so many ways to manage stress, and that's kind of looking at your life and how to balance that, busy lifestyle versus relaxation. What you need in that regard is really important. Avoiding smoking is huge. Studies have shown that hot flashes are the worst. Like the two biggest factors that impact hot flashes are smoking and a sedentary lifestyle. So that's important to keep in mind. If you are smoking cigarettes, that's one thing that, just yet another reason to consider quitting. Avoiding alcohol is a big one. Alcohol can often cause the sort of in the moment hot flashes. So, you can notice increased flushing, and they can trigger hot flashes in the moment, but they can also make us more predisposed to hot flashes the next day, by impacting our sleep and by affecting our blood sugar regulation and things of that nature. So if you're having hot flashes at night, you really want to think about keeping the room cool, and throughout the day, just kind of keeping the temperature in the room down, opening a window if you need to, things like that. That's kind of a low level intervention that you can consider. Exercise. So exercise is important for all aspects of our health. And like I was saying, one of the biggest factors that causes really worsened hot flashes is a sedentary lifestyle. The one thing that is tricky with exercise is it can often trigger hot flashes in the moment. So a lot of my patients will say, yeah, I can't exercise because it's just making me have these horrible hot flashes, and I just really don't want to do it. And I will often, I will counsel everyone that while it can often make hot flashes worse in the moment, overall, it's going to improve your hot flash frequency throughout the day. So, and this is through a number of mechanisms. It's working, exercise is affecting our stress hormones and blood sugar regulation and, our blood flow and all of that. So if, intensive exercise is just really intolerable, you may want to consider things like yoga or Tai Chi or more meditative exercises, including that a couple of times a week is really ideal for helping downregulate the nervous system, which can impart its own effects as well. And we also really want to pay attention to bone density. So ideally, we're starting to look at that, in our teens. But if you haven't until, you get to the time of menopause, you really want to look at your exercise and make sure that you're doing some kind of weight-bearing exercise. Now, we've seen that even yoga by itself can be helpful for osteoporosis. So even gentle exercise can be really helpful. But as long as you don't have more progressed osteoporosis, which is a whole different matter, if you're kind of more in the normal bone density or osteopenic realm, then going for a hike with loaded weights, so particularly on your spine, so wearing a backpack with stuff in it and going for a hike is the ideal for protecting the bone density in your spine and hips. So definitely something to think about getting going on your weekends if you can. Okay, so next we're going to get into some herbal medicine approaches to the hot flashes. And first, I'm going to take a look at our phytoestrogenic herbs. So remember, this is the types of plants that have estrogen mimicking constituents in them that will bind to estrogen receptors and have a less intense estrogen-like effect on the body than the estrogen we produce in our own naturally. So some herbs that are known as phytoestrogens include maca. So this is a nutritive herb that is it can be really helpful, especially for low libido. It's been shown to have some estrogenic effect and is also known as an adaptogenic herb, so kind of helping patients manage stress through the menopause transition. Next, we have licorice. So licorice has been shown to help with the conversion of testosterone to estrogen, thereby increasing our estrogen production. It is one that we want to be careful with if you have hypertension. So definitely talk to your naturopath or herbalist or doctor about it before starting if you have hypertension. Red clover is one of our major phytoestrogenic herbs and is often used in tea or powder form and in combination with other phytoestrogenic herbs to help manage hot flashes. And that's similar for hops. So hops, you may know from beer. It's also a major herb that's used for many different purposes. And it's been shown to bind to estrogen receptors and have an estrogen-like effect. And it also is known as a nervine, so helps calm. So it's a great one to have in a phytoestrogen blend for the evening before bed when you're having hot flashes. So black cohosh is one of our major herbs that's used for hot flashes. And it's interesting. For some people, it is the thing that whereby people are more able to manage hot flashes, and it's very effective. And for some people, it doesn't work very well at all. And that the reason for that is not very well known. But you need to take it for at least 2 months to get the maximal effect. And again, for some patients, I really have seen this help control hot flashes significantly. You can combine it with St. John's wort, and this combination has been shown to really help with both hot flashes and mood symptoms. So it's a really helpful combination. And then lastly, we've got sage tea. This is one that's often used in an herbal blend or alone in the evening. And it's a gentle cooling herb that can be helpful for cooling you off and getting you ready for bed and managing hot flashes. So here's another couple of herbal categories that I like to bring in with patients to for support during the menopause transition and for support with hot flashes. So adaptogens, this is a category of herb that is helpful for helping people manage stress. And all of these herbs have been shown to dampen cortisol release, so that thereby we're preventing cortisol, which is a stress hormone, being released in high amounts and then kind of having an adrenal crash after that. So it can be really helpful for allowing for more sustained energy throughout the day And this can be really helpful with the emotional changes and emotional turmoil that can come with the hormone fluctuations in perimenopause and menopause. So some of our major ones are ashwagandha. There's just a major Ayurvedic herb. This is really good for when people are kind of wired and tired. And then we've got American ginseng. So this is a cooling ginseng, very helpful for when you're dealing with flashes, because it's similar to the Asian red ginseng that can be more stimulating, heating, but it's kind of the American cousin that is known to be more cooling. So that's the one I'll go to when someone's dealing with hot flashes. And then lastly, we've got eleuthero. This is Siberian ginseng. And eleuthero is really helpful for calming the mind and providing physical stimulation. So when you are going through a period of feeling really physically fatigued and having anxiety, this herb is highly indicated and can be helpful, when that's a part of the menopause transition as well. So we also have herbs for liver support. So throughout our life, our liver is working really hard to process our hormones on a daily basis. And during menopause, when our hormones are fluctuating significantly, we really want to make sure to support our liver by decreasing alcohol and cigarettes and things like that. And we can also add in some of these helpful herbs like dandelion, milk thistle, and burdock for that purpose. And then lastly, we've got nervine. So these, again, can be really helpful for the anxiety and insomnia that will happen during menopause, and will often kind of coexist with hot flashes. So I really, in a formula, like to include things like passion flower, milky oats, skullcap, and kava for help with sleep and managing anxiety.
Okay, so coming into Chinese medicine, so the formulas that I have listed here kind of like our go-to like heavy hitters for menopausal symptoms. But when we formulate a Chinese medicine formula for you, we take into your whole constitution. So what you'll often see is combinations of these formulas with other herbs. And what's really interesting, a lot of those herbs that Dr. Schroeder had just mentioned and gone over are herbs that are included in these formulas. I'm not going to get into the nitty-gritty of them, but a lot of those herbs are in these formulas and have been used traditionally for thousands of years. So when we're thinking of just base kidney yin deficiency, we always go for what we call the 6 gentlemen, the Liu Wei, Di Huang Wan. And then if we have more of those heat symptoms, we add the second formula, this Zhibai Di Huang Wan is basically the Liu Wei, but adding in 2 more herbs that are clearing heat. And then when we have kidney deficiency, we use a formula called Yog Wei Wan, which is really tonifying that kidney yang. And then this major go-to, if you go to like a Chinese herbal dispensary and you say, I have menopausal symptoms, they're most likely going to hand you a bottle of Tong, which is this formula that's just so well known for menopausal symptoms. And it's really hitting like on both pieces of that kidney yin and the yang deficiency. It's also really good for high blood pressure and hypertension that we see go along with menopausal symptoms. So that Tong is really a powerful formula that can be used for many things, and it can be adjusted to your personal constitution to add in herbs or take away herbs just based on what symptoms you're having. And then there's some things that we like to add in for night sweats, hot flashes, and insomnia. One of those being one of my favorite herbs, which is Wu Wei Zi, which we know in English, it's Shisandra. It's working and it's called 5 flavors. So it has an aspect on all the organs in Chinese medicine. In Western medicine, we use it mainly as that for that liver support and supporting liver detoxification of our hormones. And that's probably likely why we're seeing it work so well with night sweats and hot flashes. And then these added hot flashes herbs are kind of what we see in this Bai. So we have this Huang Bai, which is what Dr. Schroeder already mentioned. It's Chinese skullcap, and it's really good for clearing heat. And what we're doing is we're trying to consolidate the sweating and clear heat from the system to help with those symptoms. Okay, now we're going to talk briefly, because I know we're running out of time, about hormone therapy. So HRT is a big topic, especially in women's health. There's lots and lots of controversy about it. There are some really good, robust studies, but there's also a lack of studies when it comes to long-term health. And there's a lot of debate amongst practitioners on how long a person should be on hormone replacement therapy. Is it safe? Is it not? Is it safe based on what the timing of starting the HRT? And ultimately, it's a very personalized decision. You kind of have to think about your family history. Is there any history of breast or ovarian cancer in your family? Is there any history of cardiovascular disease in your family? And I really think it warrants a deeper conversation with a practitioner to kind of decide if hormone replacement therapy is appropriate for each individual. When we think about HRT, most of the things, so when we talk about bioidentical hormones and versus not, more recently, hormones are, despite if it's compounded versus commercially prepared, are more bioidentical. We used to get a lot of hormones from like horses and horse urine. That's less so now. They're more bioidentical. So despite where you get them, they are more what we consider bioidentical versus not. If you have a uterus, you need to combine both estradiol and progesterone together in hormone replacement therapy. This is really important because, as Dr. Schroeder was mentioning, estradiol is responsible for building up your uterine layer. If we don't have progesterone to balance that, and you're taking exogenous estrogens, it can predispose you for endometrial cancer, which is not something we want. So we can combine that with progesterone to decrease the risk of endometrial cancer. Hormone replacement therapy is available in a wide variety of preparations. There's pills, there's creams that we can apply locally. So if some of the main symptoms are just vaginal dryness, local applications of estrogen creams can be more effective just in the local area, because it is making that more, the tissue there just be more voluptuous, like Dr. Schroeder was mentioning, versus doing a systemic therapy of hormones. There's also patches. Oftentimes we use estrogen patches along with progesterone pills, which seem to be kind of the easiest, most effective, versus taking a daily pill or applying creams where you need to be more aware of not getting it on your partners or children. Okay, acupuncture for menopausal symptoms is very interesting. There's not great studies except for hormone replacement therapy for the treatment of hot flashes. There's just not robust evidence, unfortunately, but there is some interesting studies with acupuncture and hot flashes. In a study, they found that acupuncture up to 20 treatments within a 6-month period showed an almost 40% improvement in hot flashes, which is very interesting. And I know what Dr. Schroeder and I like to do in clinical practice is to combine acupuncture along with these herbs to help with the symptoms. Acupuncture can also be very effective for the emotional pieces, so the anxiety, depression, sleep. Basically, what to expect from an acupuncture visit is to go over your symptoms, asking you lots of questions about you as a whole person, because acupuncture is very individualized. We need to understand what your constitution looks like and to treat your constitution versus just using certain points, because we know they are for hot flashes. You need to have a more individualized approach. And that's why studying these things can be difficult, because they need to have protocols, and everyone's different. So the effectiveness gets a little, I don't know, wishy-washy when you have to take into account that each person is an individual and you can't just use protocols with acupuncture.
Okay, so next we're going to get into the some changes in the vulvovaginal area that happen during menopause and how we can address that. So when we have declining estrogen during the menopausal transition, this will lead to tissue thinning. So as I was mentioning before, estrogen is responsible for kind of maintaining a thicker, kind of more moist, more voluptuous, I like that word that Dr. Stocker used, vaginal mucosa. And it helps, cushion the vaginal lining, and also stimulates the release of vaginal mucus. So when estrogen starts to decline, we'll have tissue thinning and then less vaginal mucus, and that causes that vaginal dryness and irritation that can happen. As the tissue gets thinner, there's less protection. And as there's less moisture, there's less kind of lubrication and protection on the vaginal lining. So this can cause things like vaginal erosions, itching and inflammation, and will often lead to things like pain with sex. So this generally happens because of irritation of the skin, and also because the tissue can become less elastic. So the vagina, as it becomes less elastic, you can have more pain with penetration and difficulty with penetration. And then we'll often see more frequent urinary tract infections. The urethra is kind of right above the vaginal opening, and that area can also kind of have less cushion, and that allows the urethra to be more open and susceptible to irritation and to bacterial influences, causing more frequent urinary tract infections. So we want to think about all of these, and make sure that if you are experiencing this, you want to talk to your healthcare provider about it. There's a lot of many patients of mine and people I've talked to kind of feel bashful or feel like, well, this is normal, I need to just deal with it. But there are so many tools that we have for addressing vaginal dryness, vaginal pain, pain with sex, and frequent UTIs. So definitely seek out help if you're, if that's bothering you. And then the last piece here is the vaginal microbiome will often change during menopause. So estrogen is responsible for stimulating the secretion of glycogen, which is the main food for the lactobacillus that make our vagina more acidic. And that's the environment that it is happiest in. And so after menopause, we're more susceptible to microbiome imbalances in the vagina, and that's something we'll discuss as part of that inflammation and irritation. Okay, so some of the things that we can do that are non-hormonal for vulvovaginal changes include vitamin E oil that can be really helpful for supporting that vaginal tissue and providing healing for any erosions. If you're still sexually active and experiencing these changes, you really want to get a good lubricant and use lots and lots of it. So one of my favorite lubricants is Good Clean Love, and it has a combination of some lubricant jelly plus aloe vera, and it has some added acidity in it to help with that vaginal pH, which will help with the vaginal microbiome. Using just aloe gel is a great strategy. I have a number of patients that really like that as a lubricant alone, and aloe has direct influence on skin. It's been shown to decrease inflammation, and it's really good when your skin is needing some healing and is irritated. So we also want to think about addressing the microbiome. So, the microbes that are in our vagina will have a major influence on the immune response in that area. So often we'll want to think about using a probiotic cream to prevent things like bacterial vaginosis and candida, to prevent kind of these vaginal infections that can happen when the vaginal environment is not optimal. And then we want to think about things that lower the vaginal pH, like Be Fresh, which is just a really simple vitamin C that can be used vaginally. And then lastly, we've got vaginal estrogen. So Dr. Stocker was talking about the systemic use of hormones for menopausal hot flashes. So, that is a dose that will sort of bind to receptors all over our body, and that is really one of the most effective strategies we have for menopausal hot flashes, which is why so many people use it, even though it's controversial. But when it comes to treating the changes in the vagina that happen with menopause, we can use a cream that it will be dosed to be local. So it will just have local effects on the vaginal mucosa and not be absorbed systemically and affect our systemic estrogen load significantly. So this is considered relatively safe and is now considered safe throughout the medical community. So even to the extent which this sounds extreme, if someone has active breast cancer, you can still use this cream, this local cream safely. So that's something that I like to make sure to distinguish between the systemic estrogen and the local estrogen. Their kind of risk benefit ratio is very, very different. So we'll often use compounded creams or the pharmaceutical form of the creams for supporting the vaginal tissues and preventing things like vaginal irritation and the frequent UTIs. And again, Dr. Stocker touched on this briefly, but so now the compounded and pharmaceutical forms of estrogen and estriol are often pretty much the same. So the active ingredient is more or less identical. And often the pharmaceutical version is cheaper, which is really great. And sometimes I'll offer that to patients for that reason. But one of the reasons we'll often do compounded versions is because we have much more of choice surrounding the ingredients that go into it that are added. So, sometimes the pharmaceutical versions will have things like parabens and, other binders that that a lot of patients don't want to be exposed to. So that's one of the reasons we'll often use compounding pharmacies. And also each base will have a different kind of influence on absorption. So it's, lots of things to consider. It's very interesting. Good to talk to a provider who has experience with that when you're interested in getting hormone replacement therapy. And then lastly, we've got suppositories. So we can use vitamin E suppositories, calendula suppositories. There's a number of herbs that we can combine in there. And then there's some suppositories that have estrogen in them that you use just twice a week, and it can be very effective for managing those symptoms. Okay, so I was mentioning that when with these vulvovaginal changes, often we can have this kind of constriction of the vaginal opening. And this can oftentimes lead to pain with sex. With that less elastic tissue, you can have kind of a narrowing of the vagina and difficulty with penetration. Many patients will describe the combination of the skin rawness and that constriction at the vaginal opening as the ring of fire. So with penetration, we'll have this kind of burning, searing pain. And this is one of the conditions that pelvic floor therapy is really useful for. I'm now offering this at ARIA, and it's been really great to work with patients to reduce that pain and enable them to have, more enjoyable sex lives later in life. So with this pelvic floor therapy, we'll often use relaxation exercises. So it's often with that kind of pain cycle, you'll have a lot of tensing in the pelvic floor. And, the muscles around the vagina will get really tight and tender. And so we'll often be using a combination of strengthening and relaxing exercises, depending on whether or not someone's kind of more hyper or hypotonic in their pelvic floor muscles. And then we'll do intravaginal pelvic floor manual release of the pelvic floor muscles. And then there's many tools that you can use at home. One of the main ones for this kind of narrowing of the vagina is vaginal dilators. So those are inserts that are graduated in size that can help expand the vaginal opening. Okay, so that concludes our doc talk for today. This is, a topic that is really near and dear to my heart, and I know Dr. Stocker has a lot of passion for treating menopause as well. I really am, it's important to me that each patient is aware of the variety of options that are available for treating menopause and treating especially hot flashes and the vulvovaginal changes. So it's really just important to reach out to a variety of providers and make sure that you're getting the full range of your options and making decisions with someone who's able to kind of talk you through the risks and benefits and have you involved in the decision making. All right, so if you're dealing with any of these symptoms of the perimenopause and menopause transition that we were discussing today and need help with it, feel free to give us a call and set up an appointment for either naturopathic medicine or acupuncture. And stay tuned for our upcoming doc talks for more information on different subjects. And we'll look forward to hearing from you.